To assess fathers' perceived needs of support within the Swedish child health field, I conducted a literature review and meta-ethnography. One example of a father-midwife or nurse interaction will be provided from each arena within the Swedish child health field. The vast majority of fathers in Sweden attend prenatal clinics. During the first visit, midwives typically perform an intake where they ask mothers, but not fathers, about their smoking and snus, alcohol, and drug habits. Later during the prenatal period, mothers are further screened for STDs as well as their weight gain. Even though fathers' smoking, drinking, and drug habits can negatively impact the mother and/or his child, he is still not screened and therefore not provided with referrals to help reduce or eliminate these unhealthy habits. Nearly all fathers in Sweden attend the birth of their child and find great joy in comforting and supporting their partner, as well as being part of the birthing experience. However, not all births are risk-free, and when risks increase, the potential trauma to fathers can be great. Watching helplessly as dozens of midwives, nurses, and doctors rush in to investigate and solve the birthing problem can be overwhelming for many fathers. But when at least one member of the medical staff approaches the father and provides emotional support, as well as factual information about what's happening, both to his partner and about his baby, and what the potential outcomes may be, then fathers feel less stressed and less anxious. In fact, they feel empowered in an otherwise helpless situation. This emotional support, via information, can have positive, lasting impacts on his birth experience. When new parents arrive at the postnatal ward, they face several struggles, such as how to breastfeed, changing their baby's diaper, and how to manage typical daily activities like using the restroom after having just pushed out a baby. Fathers are an important support for mothers during the postnatal period, providing her with comfort and support. This in turn means that the midwife doesn't need to visit the room as often. Fathers also benefit themselves, as for the first time they are all together as a family. Fathers want to bond with their baby and with the whole family. They want to share in the love. As such, fathers want to spend the night with their new baby and partner. However, not all fathers can spend the night with their new family. Some postnatal clinics say that fathers need to go home, that there's no room for them. Others charge a fee for the father to spend the night, while there are no charges for mothers. This makes fathers feel like they aren't important. Think about that for a minute. On the first night of their child's life, they aren't important enough to be together as a family. The psychological impact of hearing this news, the societal message that this news sends, goes against Swedish ideals of gender equality and encouraging equal parenting. At the child health centers, fathers see a child health nurse. They view these nurses as professionals and respect their parenting and child health advice. When fathers come to the child health centers, they often have a number of parenting questions, such as how to manage their child's sleep and how to work as a co-parenting team with their partner. They also receive support for their own health, such as if they're having anxiety or fear related to parenting a newborn or young child. And they are provided with support about their child's growth and development. When the child health nurses engaged the fathers and answered their parenting questions, then fathers felt supported and increased their participation. Fathers see midwives and child health nurses as professionals. They want to have a positive relationship with them. However, some fathers feel excluded, invisible, and left out of important decisions. In addition, it is important to mention that many of the fathers' negative reflections are not directed at child health professionals, but rather at organizational structures and managerial decisions. Therefore, if Sweden wishes to have more equal parenting, fathers need to be better included and supported, including within and beyond the Swedish child health field. For details on the ways fathers are and are not supported throughout the Swedish child health field, click on the link below to find the published article.